Assalamualaikum and very good morning, girls. Okay, how are you today for Bestari and for Cerdas? I hope you all in good condition, yeah, and always have a high motivation to learn. Okay, so let's go to our last subtopic, yeah, in the chapter 9. Okay, what is the title? It is 9.7. Have issues related to the digestive system and eating habits. Okay, I repeat, the title is Health Issues. Ya, isu kesihatan ya, related to the digestive system and eating habits. Okay, so let's not wasting our time. We go to the learning standard that you are going to cover for today. Okay, you are able to predict the effects of modifying digestive organs on human health. Yeah, predict the effects of modifying digestive organs. Yeah. Okay, and then second one, outline health issues related to defecation. Yeah, health issues related to the defecation. And last one is correlate health issues that are related to the eating habits. Yeah, correlate health issues that are related to the eating habits. Okay, so these are the three learning standards that you have to cover for today. Okay, let's go to the adaptation of the digestive organ. Yeah, adaptation of the digestive organ. Right, so we are going to discuss the adaptation, adaptation of the digestive organ that related to the stomach here. Okay, let's go to the definition first or introduction. Okay, obesity is a health issue on the rise throughout the world. Yeah, obesity. Okay, what is the obesity? It is overweight. Yeah, overweight, where the BMI is over than the normal. Right? Okay. Although obesity can be controlled through diet management and routine exercise programs, at times obesity requires medical treatment. Alright, okay, so that is an introduction to the obesity. Alright, okay, let's continue. Okay, specialist doctors may suggest surgical procedure. Yeah, okay, specialist doctor may suggest surgical procedure to reduce body weight, yeah, such as gastric bypass. Okay, for the obese person, yeah, for the obese. So usually the doctors will suggest to do the gastric bypass. Yeah, the gastric bypass for the obese person. Yeah, for the obese person. Okay. So, what is the purpose of the gastric bypass? It is to reduce the body weight. Yeah, to reduce the body weight. Okay. So, this is referred to the diagram of the gastric bypass. Okay. What happened here? Yeah. The doctor will operate the stomach. Yeah, okay, so we'll operate the stomach and we'll cut off the stomach. So it will reduce, it will reduce the size of the stomach. And then it will what happened here? Yeah, what happened here? So the stomach here will directly connected to the jejunum. Yeah, directly connected to the jejunum. Alright, so what happened here? It will cause less absorption of the nutrients occur. Yeah, less absorption of the nutrients occur. Yeah, okay, because the alimentary canal is already shortened. Yeah, already shortened. Yeah. Okay, a gastric bypass involves a reduction of the stomach size using various methods of surgery. Alright, okay, so that is a gastric bypass. Okay, so what is the effect or the short-term side effect of this surgery? Yeah, so among the short-term side effects of this surgery are acid reflux. Yeah, acid reflux, and then cause nausea, vomiting, expanded esophagus. Yeah, expanded esophagus refer to the esophagus become bigger in size, a little bit. A certain food prohibition and risk of infection. Okay, that is a short-term side effect. Yeah. Okay. Okay, so what is a acid reflux? Acid reflux refer to the burning sensation, burning sensation that on the lower chest. Yeah, so we feel burn on the lower chest because it occurs because the acid inside the stomach, yeah, acid hydrochloric acid inside the stomach, uh, it back up, it flow back to the esophagus. So it will cause the acid reflux. Okay, nausea ni adalah merujuk kepada lawyer, ya, lawyer, rasa nak muntah, and then vomiting, yes, vomit, muntah, expanded esophagus, that I already explained just now. The esophagus become bigger in size, and then, okay, the long-term side effects. Okay, what are the long-term side effects? Dizziness, dizziness, low blood sugar level, okay, low blood sugar level, yeah, that cause the sugar level or the glucose level in the blood decrease, yeah. Malnutrition, malnutrition, stomach ulcer, and defecation problems. Okay, that is referred to the long-term side effects. Okay, this is referred to the gastric bypass. Yeah, bypass. Okay, next we go to the health issues related to the defecation. Yeah, health issues related to the defecation. Okay, so actually, what is a defecation? We already discussed in the 9.6. So defecation is the removal of the feces, yeah, removal of the feces through the anus. Okay, so what are the health issues, yeah, related to the defecation? Okay, we go to the introduction first. The food class that is most important in the defecation process is fiber. Okay, the food class that very important in defecation process is fiber. So fiber can be taken by eating, by eating the vegetables and also fruits. Yeah. Intake of diet that is high in fiber, such as fruits and vegetables, can smoothen bowel movement. Yeah, okay. So bila kita mengambil banyak buah-buahan dan juga sayur-sayuran, so dia akan melancarkan, melancarkan pergerakan bowel. Bowel ni merujuk kepada intestine, intestine usus kita. So this can prevent health problems such as constipation, constipation, colon cancer, rectum cancer, and also hemorrhoid. So what is a constipation? Constipation dalam bahasa Melayunya sembelit. Okey, apa tu sembelit? Susah untuk membuang air besar, That is constipation. Colon cancer, there is a cancer on the colon part, in the colon part there is a cancer. Okay, rectum cancer, cancer on the rectum part, and hemorrhoid. So what is a hemorrhoid? Refer to the bloody feces, so bloody feces. Okay. So this is example of the this is referred to the, okay, can you see? Yes, so this is referred to the colon. So even this is related to the colon cancer, and this is referred to the rectum. So rectum that related to the rectum cancer or inflammation on the rectum. Okay, the functions of the fiber. Okay, what is the function of the fiber? Stimulate peristalsis. Okay, what is a peristalsis? It is referred to the contraction and relaxation of the smooth muscles along the alimentary canal that push the content of the alimentary canal down, yeah, okay, or downwards, yeah, okay. So absorb and expel toxic substance, yeah, okay. Fiber can absorb and expel toxic substance. The fiber also can regulate the absorption of the glucose, especially for diabetes mellitus patient. Okay, diabetes mellitus refer to the what is a diabetes mellitus? Dalam bahasa Melayunya adalah kencing manis, ya. Increase the population of the beneficial bacteria in the large intestine. Okay, so we already discussed that in our intestine, large intestine, there is a good bacteria. So, good bacteria, yeah, the good bacteria is very important to our body, yeah, to our body because it can fight on the bad bacteria and also can provide us vitamin, yeah, vitamin. Okay, so now we go to the health issues related to the defecation. The intake of a large amount of water can ensure that the feces stays soft and move easily along the large intestine to aid the process of defecation. So you have to take a large amount of the water per day, yeah, per day. So in a day, make sure you drink 7 or 8 glasses of water. Yeah. Okay, why? To make sure our feces stay soft and move easily. Yeah, easily, or to allow the peristalsis or the movement of the digested food, yeah, or undigested food flow easily. Okay. Now we go to the health issues related to the eating habits. Okay, health issues related to the eating habits. Okay, so kita akan bincang isu-isu kesihatan yang berkaitan dengan tabiat pemakanan. Ya, tabiat pemakanan. Okay, apart from a balanced diet, eating habits also play an important role in fulfilling our energy requirements and maintaining our health. Ya, eating habits also play an important role. Ya. Eating habits ni merujuk kepada tabiat pemakanan kita, cara pemakanan kita. Okay, poor eating habits and an imbalanced diet. And imbalanced diets can cause numerous health problems such as gastritis, muscle dysmorphia, anorexia nervosa, and bulimia nervosa. Okay, so apa tu? So that is referred to the health problems that related to the poor eating habits and also imbalanced diet. Okay, so let's discuss one by one. Okay, we go to the gastritis. Okay, so what is a gastritis? It comes from the word gastric. Okay, gaster. So gaster refer to our stomach. Yeah, okay, gastritis refer to the inflammation of the stomach wall. Okay, so what is a gastritis? Refers to the inflammation and corrosion. Yeah, inflammation, yeah, and also corrosion. Yeah, corrosion of the stomach epithelial layer by gastric juice. Yeah, by the gastric juice. Okay, as we know that gastric juice consists of the hydrochloric acid, yeah, where the pH is around 2. So it will corrode the stomach epithelial layer. Okay, when there is no food in the stomach. Yeah, when there is no food in the stomach. Okay, untreated gastritis can result in the gastric ulcer. Yeah, okay, can result in the gastric ulcer. Right. And then the causes of the gastritis include eating irregular quantities of food at irregular hours. Okay, so I repeat, what are the causes of the gastritis? First cause is eating irregular quantities of food. Eating irregular quantities of food at irregular hours. Ya, at irregular hours. Maksudnya apa? Makan kuantiti makan makanan yang tidak mencukupi ataupun irregular yang tidak sesuai ya at irregular hours ya okey maksudnya tidak makan tidak mengikut masa yang sesuai ya for example you skip the breakfast ya you have your breakfast at afternoon so it will cause the hydrochloric acid inside the stomach corrodes your epithelial layer ya. And then also the other causes is excessive intake of the alcohols or painkillers ya painkillers. As examples of the painkillers such as aspirin sometimes panadols right but that is not the main causes right that is not the main causes the main causes is eating food or irregular quantities of food at irregular hours. Okay, we go to the second health issues related to the eating habits. Okay, it is bulimia nervosa. Okay, bulimia nervosa. They are also obsessed. Okay, obsessed with controlling their body weight. Control their body weight. They will eat a lot and vomit out the food that they have eaten or take laxative that cause diarrhea. Okay, so this person they want to eat. They will eat a lot. After that, they will they will force the food out of the body. Yeah, okay, it will vomit out. Okay, so or they will take the laxative. Yeah, laxative. So laxative it will cause diarrhea. It will cause diarrhea. So in the long run, in the long period, the patient may suffer from dehydration, nutritional problems, and eventually cardiovascular disease or kidney failure. Okay, that is referred to the bulimia nervosa. Yeah, because they are obsessed of controlling their body weight. Yeah. Okay. So that is a bulimia. Bulimia ni maksudnya bully. Dia membuli badan dia sendiri. Yang mana mereka makan after they eat, they will force the food go out again. Ya, okay. So macam mana cara dia memaksa makanan tu keluar? So dia akan menjolok jarinya ke dalam mulut and then will cause vomiting. Alright? Okay. So that is a bulimia nervosa. Okay, then the third eating health issues. It is anorexia nervosa. Okay, anorexia nervosa is quite common amongst teenage girls. Teenage girls who are obsessed with their body weight. Their body weight. Okay, anorexics will avoid food. Okay, so this person will avoid the food. They will insist the food. Okay. So yang ini langsung tak makan Avoid food to achieve their ideal body weight. Bukan langsung tak makan, maksudnya dia tak makan, dia sanggup tak makan untuk dia menurunkan berat badan dia. Menurunkan berat badan dia untuk nampak cantik. So they also suffer from psychological problem and nutrient deficiency because of their normal digestive system is affected. Alright, okay. So that is anorexia nervosa. So they will avoid taking the food. Avoid taking the food to achieve their ideal body weight, or they only eat less food. that when they eat less food, so it will cause an imbalanced diet. So when imbalanced diet, it will cause nutrient deficiency. Yeah, right. Okay. Last one is okay. So the last eating habits. Yeah. Um, it is referred to the muscle dysmorphia. Yeah, muscle dysmorphia. Okay, some individuals feel that their size is small with not enough growth. Okay, so these are issues. Yeah, usually occurs among boys. Yeah, okay. So they feel that their size is small. Yeah, that their body size is small and not enough growth. Okay, so they subject themselves to extreme weightlifting training and exercise. Okay, so they force themselves to get the extreme weightlifting training and exercise. Okay, sometimes they consume steroids. They consume steroids. Steroid is one of the uh, component of the lipids. Yeah. Steroids ni biasanya hormon ya, dia akan mengambil hormon apa to uh, to allow their muscle grow, yeah, or muscle building supplements. Okay, and this health issue is called muscle dysmorphia. Okay, so this is referred to the last issues, yeah, last health issues that related to the eating habits. Okay, so I repeat, yeah, so we have discussed about the effects of the modifying digestive organs on the human health. That's referred to the effect of the modify the stomach, yeah, for the obese person, yeah. So that modifying process we call as gastric bypass. Okay, so we had discussed the short terms and the long terms effect of the gastric bypass. And the second one, we also discuss about the health issues related to defecation. Yeah, health issues that related to defecation. And then we also discuss about the health issues that related to the eating habits. Okay, so that eating habits related to the gastritis. Yeah, okay, gastritis, and then bulimia nervosa, anorexia nervosa, and also muscle dysmorphia. So make sure you can differentiate between these four eating habits, especially bulimia nervosa and anorexia nervosa. Okay, so that's all for today. I hope you can understand. Okay, please okay, please do your revision a lot, yeah, and study more, and then read again until you do really understand the concept of the chapter 9. So chapter 9 nutrition is very important, and it is closely related to our daily life. Okay, so I hope you can apply all the knowledge that we learn in the nutrition and the digestive system in our daily life. Okay, that's all for today, girls. Okay, take care, everyone.